So, a very good evening to all of you. A very warm welcome to all the participants for the today's session from the Divine School of Homoeopathy. So, my dear friends, all of you are here on the very special occasion. Yesterday, we have celebrated the International Women's Day. To all women who have joined today for this session from the Divine School of Homoeopathy, a very happy International Women's Day. And we'll start with our topic, which is specially designed for this occasion, the homeopathic management of the women's disorder. There were many my students who asked me, who are practicing gynec or they have their own hospital, sir, we have to utilize homeopathic remedies in our IPDs or in our OPDs, but we want some guidance. It was there in my mind since long time. And that's why I have decided this topic so that I can share whatever I have learned. I will going to share certain important cases which I have learned during my internship period, during my early practice, when there were no computers, no mobiles, no softwares, and we have to rely only on two repertories. One is Kent's repertory, which was very familiar with us, and there was one more repertory, that is the Barthel's repertory, synthetic repertory. Today, I have considered certain cases from my internship diaries during the period of 1990-1991, when I have attended our DSHMC's Sanjeevani Hospital, Pune. And with the guidance of all the teachers, there were 9 practitioners, homeopathic practitioners, who used to work over there in that hospital. And basically, with the guidance of our principal, sir, Dr. MP Arya, sir, I have utilized many homeopathic remedies over there. And that was, in fact, a first starting point related with the repertories, because he was there always behind us. Whenever we used to, there is case, he used to discuss and he used to ask, Rasal, kya dene ka? What medicine you will decide? And if he'll say something, then he answers why. The question was there always in the form of why. We have to explain him the rubrics. He expects the rubrics on what basis you are going to prescribe the remedy. And in fact, that was the reason because of which I was very much familiar with the Kent's repertory, basically with the particular chapters. And second thing, whenever I used to come to Sangamner, our own hospital was there where the maximum work was of gynec and obstetrics. So many patients I got over there at the start of my practice, which were not only came for the homeopathic consultation purely, they came for their problems. And I have utilized homeopathic remedies over there on the basis of Kent's repertorization. So today I will going to share all those things, and that will give you a different idea of looking toward the things. Here I will going to mention the prescribable data while narrating the cases. The whole case I have not explained because I want to show you many things. I want to show you a logic. I want to tell you exactly how one can think. And for that purpose, I have selected only a prescribable data. I will going to share 9 cases. So we'll start with the session, the first case in itself. Case, if you have Kent's repertory, just open the repertory. If you read the case, only on one page there is a case, and you just find it out what is there. If you get that, that will be better for everyone. That will take you into the particular chapters, into the specific rubrics, and you can find it out, those rubrics, which will be very useful in your practice. This was the case from our own hospital. A 28 years married woman presented with leukorrhea with severe uncontrollable itching in the vagina and on labias both sides. and in between, treated with local antifungal vaginal tablets as well as oral antibiotics and antifungals without much relief. So this was the case. This was the basic thing, nothing special. And she was suffering a lot since last 3-4 months. And she was so disturbed because of it, because that was just a pruritus vulvi, which was very marked. Remedy was there in my mind because I have learned the remedy, but without a proof, I never prescribed. So that patient asked me one question: is there any role of homeopathy? That was the question to me from the patient. And it was really a challenge for me. Whenever such question is there regarding the homeopathy, I used to think, yes, how I will going to treat that and show that yes, homeopathy works for it. So what are the rubrics over here? Unless and until we find it out, the rubrics, it is not possible to confirm your remedy, which is there in your mind. I know you know the remedy. Many of you are practitioners. Everyone knows that. But my suggestion is that not going to the remedy directly. Remedy is there, but what are the rubrics which you are going to look for? So Kent's repertory was the only source at that time. So today I will going to share only the rubrics from the Kent's repertory. And at that time, I was very familiar with the particular chapters of the repertory. I was very familiar with Allen's keynotes. I was very familiar with Borix Materia Medica. And because of which, I was going towards the particular characteristics in each and every case. So I used to look towards those, what is there in the case. So 3 important symptoms which I have selected: genitalia female, itching, vagina, voluptuous. Then second is itching between the labia, and third, itching leucorrhea from. Very simple rubrics. Yes, that's all. And remedy was also simple. Creosote. Everyone knows this is very specific remedy for the pruritus vulvi. Yes, definitely. But how to utilize? I have worked with many practitioners over there. I have developed a logic, different logic, a clinical logic. I was there since that time. I was using the remedies in a different manner. I never used to prescribe like a classical homeopath, give a single dose and wait for a month. It was not there with me. Whatever I have learned from the Boric, Allen's or source books. So I have prescribed the creosote to this patient. I have asked one thing, asked to avoid physical relations for a week. Because of this, the itching gets aggravated. This is very important. You have to tell all those things to the patient, and you should be very open enough to explain all those things so that it will not aggravate the problems. So I have given creosote 30 TDS for a week along with calendula Q locally for the vaginal wash. Many of we never use this. If you read the Borix Materia Medica, he has very specifically mentioned regarding the use of calendula locally. If it is vaginal candidiasis, if you find the fungus over there or a thick leucorrheal discharge is there, it is always candidial. At that time, calendula locally helps a lot. It covers immediately the leucorrhea. See what Borix says. Borix says it is a locally aqueous calendula for all wounds, the greatest healing agent. But second sentence which he has used was very important. Also as an injection in leucorrhea, internally tincture to the third potency. And I am using in each and every case of leucorrhea this calendula vaginal wash. Mother tincture I used to use. I asked the patient to enough at least 200 ml or 300 ml, 15 drops to 20 drops in a lukewarm water and wash. There should be a vaginal wash. It immediately stops the itching, irritation, discharge, and it works beautifully. So that's my aspect of using. So follow-up was very fantastic. Patient recovered completely within a week. Local calendula was continued for another week to prevent the recurrence, and patient was solved. So see, simple things are very simple, but we have to use it in a proper manner. Second case was from Sanjeevan Hospital. It is our own hospital over there while learning. A 35 years married, tall, slender, withered woman in a rainy season presented with profuse bright red vaginal bleeding since 3 weeks. She said that her bleeding was increased due to thunderstorm happened in last week. She has used many anti-hemorrhagic remedies, the hormonal tablets, and that gynecologist told her that there is only one way with which your problem can be solved is to do the hysterectomy. She asked homeopathic aid to prevent the surgery in the hospital. So that's why she was there in OPD. I was sitting along with the RS. And sir asked me, Rasal, kya dene ka? What's the remedy? I said, sir, phosphorus. Sala logic lagata hai. He used to call, he used to always, no sir, it is given in repertory. So he was always fond of repertory. He always used to see each and every rubric and then he satisfies, otherwise not. That's what the habit he has developed. So I have opened the repertory. I asked him, yes, sir, these are the things which are given over there. So what are the rubrics? If you open the Kent's repertory, you get very specific rubrics. Genitalia female, menses copious, withered woman in. Menses copious, lean woman in. Menses bright red. Menses copious, thunderstorm from. See, very specific rubric. Phosphorus, natrum carb, 2 remedies mentioned by Kent. Menses copious, tall woman. This is also a rubric given over there in Kent's repertory. We never open the particulars. We generally think only about the first chapter mind, and we used to think only on that aspect. And many a times it's a judgment. Instead of going into the reality, instead of going to what is presented by the patient. So this was very easy to come to the phosphorus. So phosphorus was given to the patient, asked to avoid the physical exertion as she was looking anemic. This is what sir told her. And biocombination 1 was given. Biocombination 1 was anemia for anemia. It contains the calcarea phos, it contains the param phos, it contains natrium. 3 agents which are required for the production of hemoglobin, as Sussler has very nicely explained his 12 tissue remedy. So it was very, very nice presentation by RSR. He said, yes, give it, very correct. Bleeding stopped on 3rd day completely. Biocombination 1 was continued for 3 months by sir for anemia. And she had regular menses thereafter for next 6 months. She used to come to OPD regularly. So this was fantastic experience which I got. The third case was again from our own hospital. A 32 years married woman presented with dark black stringy leukorrhea since last year without any result of local and oral allopathic medicines except some palliative effect. And they asked the same thing, sir, doctor, is there any role of homeopathy? Can we get the help of homeopathy for this problem? So question was again same. So you have to find it out the remedies. So which are the remedies which you can think in such types of cases? We know the 3 important rubrics which are mentioned over there. If you go with the case again, yes, you just open the Kent's repertory, the female genitalia chapter, and you get the rubrics, very clear-cut rubrics, and you get the remedy. And the remedies which you select from the Kent's repertory generally never fails because they are experienced by Kent. He worked over them a lot. So what were the rubrics? Rubrics were simple: leukorrhea dark, leukorrhea black, But third rubric, which was very important, leucorrhea, ropey, stringy, tenacious. The only remedy was the crocus, which covers all three rubrics. So I have given the crocus along with the calendula. Already I have mentioned why calendula. I asked again the same thing to the patient. They should avoid the physical relations for a week period, and I have continued with the crocus sativus 30 because crocus has a very typical stringy discharges. Even a bleeding is stringy in crocus. So crocus was prescribed and patient recovered completely within a week. Local calendula was continued for another week, and afterwards, after 1 month or 2 months, she again came with same complaint. One dose of crocus 200 was sufficient for her to cure. So this was very typical with the presentation of the. This is again from our hospital. A 27 years woman during confinement period after third delivery presented with. She started getting prolapse of uterus better by lying down and crossing the limbs. Doctor asked her to wait for a year and go for surgery because she already had 3 children. She asked, can homeopathy do anything to prevent the surgery because my age is very less? I don't want to go for removing my uterus. My answer was, why not? Because at that time, I was too enthusiastic. I was young enough. So always never thinks whether it is mechanical problem will work or not work. No question of thought. Enthusiasm was full of. So I said, why not? But when I prescribed, I was in doubt because till that period, the prolapse, I have never considered it might be cured with homeopathy. So I considered the following rubrics. Rubrics were very simple again. Genitalia female, prolapsus uterus, confinement after. This is very important. This is given over there, Kent's repertory. Confinement after. She was just delivered a month or 2 months back. Prolapsus uterus lying down Amalrex, prolapsus uterus crossing legs Amalrex, sepia clear-cut prescription was there. But this was the first trial that whether mechanical problem gets settled with homeopathy or not. I have prescribed sepia 30, 3 doses on day 1 and 2, along with biocombination number 26. 26 was prescribed because biocombination 26 contains calcarea fluor, calcarea phos, and kali phos basically, along with mac phos. These phos are very, very important to control or to strengthen the muscles, perineal muscles. Calcarea fluor is very specifically mentioned by Schussler. If it is calcarea fluor is missing or it is molecular deficiency is there, it used to produce pendulous abdomen. That much weakness develops. So all those ingredients are there in 26. That's why I have prescribed 26 along with that. And to my surprise, the patient recovered completely within 6 months. She received sepia every month, a higher potency, 200, 1M, 10M, 50M, CM within 6 months, and it worked. By combination 26, I have continued for 6 months. Perineal muscle contraction exercises continued, and that was very important. To contract the perianal muscles, the periurethral muscles, and that exercise gives strength to the structures lying over there in the pelvic cavity, because of which there will be a good hold on the uterus and uterus gets contracted. It comes again inside. This is very good exercise for such people, for rectal prolapse, for vaginal prolapse, from the prolapse uterus. This is very important exercise you can ask. So these are the 4 important cases I have shared. Now there are cases where you have to just look and think, yes, what is the remedy? What is the rubric? And that rubric gives you a remedy directly. But that rubric, you have to find it out over there. So case number 5 was very simple. Just look at this. What is this? Anyone, what do you feel? This is the labial commissure. and you can see, you can watch something. This is very important. If this thing, if you able to catch, you can get the remedy. And you never think about that. No, it is not candidiasis. This is an ulcer over there. This is a aphthous ulcers, vaginal aphthous ulcers. She was a 25 years female, and she came with these vaginal ulcers, aphthous ulcers. We never think about that. This is the rubric which is there. And you can find it out. A remedy mentioned in the rubric. Kent's genitalia, aphthy vagina. Only remedy mentioned was colophyllum. Single remedy, colophyllum. Very important. So you have to catch. This is the spotting. Very important. You catch that thing, and you can get the remedy. So colophyllum 30 TDS for the week. I asked to avoid physical relations for week because ulcer gets aggravated because of an injury, and calendula Q locally for vaginal wash because it is a healing agent. It worked beautifully. Patient recovered completely within a week. Local calendula was continued for another week to prevent the recurrence. Then case number 6. This was interesting. This case was from St. John Hospital. A 35 years married woman admitted in the hospital since 8 days with left ovarian abscess with septicemia after laparoscopic rupture of left ovarian cyst, not responding to higher antibiotics. So she was admitted over there, and she was not getting results. She was in septicemia, and sir told me that, Prasad, just see that patient and we'll find it out a remedy for that patient. So I said, sir, this is the case, nothing more, nothing specific. Patient is having a very much high grade fever. He said, open the repertory, we'll find it out a remedy. And to my surprise, he showed me one rubric over there. Genitalia abscess ovaries left, only remedy lachesis. Lachesis is the remedy which has the septicemia. Lachesis is the remedy which is very useful in the abscesses. It covers, it has a capacity to cover the septicemic state. So it was very, very specific. So he showed me how to look into the specific point, and because of which I developed such a thing. So it was fantastic for me. So we have prescribed him lachesis 200 to her, lachesis 200, 3 doses, along with placebo, and she was followed over there. And within 24 hours, the fever subsided in that case. She recovered completely thereafter within a week. So it was fantastic to see over there. This case number 7 was again from my OPD early in my practice. A newly married couple entered my clinic with the following problem. Actually, husband told me complaints about his wife that she is having severe pain when they do sex. They were just married 2 months, 3 months back. Actually, it starts when we attempt coition at the time of orgasm. It becomes so painful that she says no for further relations. Actually, we went to one lady gynecologist who gave her local jelly, but it didn't work. He asked, can homeopathy do anything for this problem? So, a case was very important. Case is given over there by her husband. She never talked anything, but she had such a problem. So, what is the rubric? Kent's repertory gives the answer. Genitalia, coition, orgasm, painful. Only remedy, single remedy mentioned, natrium muriaticum. So, I have given natrium muriaticum 1 m. I have done the counseling and advice regarding the physical relations. Because this is too important. When you talk about those things, it is very essential to tell them that they should keep the contacts, but there should not be any hurry. They should be little bit, the husband should be, I talked with him and I asked him to keep a patience, and then I have given the medicine. Natramure, yes, and it worked. Patient's husband gave me a follow-up after the medicine, everything, he said everything is fine. She feels shy to come for follow. Thanks, doctor. That was the follow. And this is too important. We never think of natramure in such types of cases. So we have to understand what the patient is expressing, what the patient is giving you. And it is there in Kant's repertory. The particulars, characteristics are very nicely mentioned by the Kant. Kant's repertory in that way, if you learn, then you learn a lot about from the Kant's repertory. Then we have two more short cases. This is the case, and you have to diagnose what is this. This is very typical. Anyone, can you find it out? What is this? It is condylomata, genital condylomata. It is soft, red, fleshy. You can find it out, redness, soft, fleshy condylomata over there. She was 35 years female, complaining of this condylomata. So nothing more than that. What you will prescribe? Again, you have to open the repertory. You have to find, is there anything rubric? Kant's repertory, genitalia, condylomata, soft, red, fleshy, and only remedy mentioned by him is natrum sulphuricum. So natrum sulph, very important remedy. Same thing I have asked, avoid physical relations, and I have given natrum sulph 6C 3 doses every 15 minutes, day 1 and 2. Placebo 4 pills daily, and I have asked them calendula Q locally. You'll ask, what is the role of calendula? Calendula, if you open the Borix Materia Medica, you'll find that on first sentence in the female part, what's at the os externum. This is mentioned by Bori regarding the calendula. So calendula is a very good remedy to be utilized for such things. So I have given local calendula. Condylomata started shrinking in size. She required natrum sulph 30 and 200 in further follow-ups for 2-3 months, and recovered completely within 8 months, and whole thing disappeared. It took nearly about 7-8 months because it was a structural change. Structural changes never disappears very fast. It requires little bit time. So it took nearly about 8 months. And last case, which I want to show you, it's again interesting case, case number 9. Just look towards it. The diagnosis is very clear. What is this?
Warts.
Warts, very
Vaginal wart.
This is again a condylomata, wart-like. It is a 50 years widow female, condylomata, wart-like appearance. Very typical. It is disturbing. And such a pathology we have to look for in our repertoire. So what is the rubric? Rubric is very simple. Genitalia, excrescences, uterus, wart-shaped cervix. Thuja is the only remedy mentioned over there. So I have started with the Thuja 6C, TDS for 5 days, placebo, 4 pills BD for 15 days, and calendula Q, as I mentioned earlier, that it is very specifically mentioned for warts on external os over there on in the female genitalia. She required, condylomata started shrinking in size. She required Thuja 30 and 200 in further follow-ups. Nearly about 1 year has required to fall down all those things. It disappeared gradually, and she completely recovered with the Thuja 30 and 200. I never have to go to higher potencies because it was local affection over there. So we have seen 9 cases in today's session. And all cases gives you something to look into the chapter. This is very important. You have to find it out exactly what is given at a particular level. We forget. We only open the first chapter again and again. This is too important to understand all those cases. So we learn today the specific aspect of finding it out, rubrics at the particular level where it becomes more characteristic. Kant's repertory is based upon this deductive logic. And this deductive logic gives you aspect to find it out exactly the characteristic over there. If you are able to catch, then exactly you can find it out. You can find it out right remedy and you can utilize this. So this is what we have learned today. There was one question by Amit sir, what the gap period into consecutive potencies? Nearly about a 1 month. I generally used to find it out if I used to use a deep acting remedy. I generally used to use a gap of 30 days minimum. If the still earlier remedy is working, I used to keep more than that gap also. But these are the things which gives you aspect to look towards the very specific thing that homeopathy works when you find it out a right remedy and right rubric. Kent's repertory is one of the very important repertory one should not miss. So that's what the message I want to show you. If it is possible, we'll continue with the same topic at the emotional level, what the emotional problems are there with the females. That also we can discuss when the time persists. Thank you being there. Thanks many practitioners who are there in today's session. Dr. Ali, Dr. Jayesh Sagar sir, Dr. Anita, many of you are there. So thank you for being there and we'll meet whenever time permits on Thursday. Thanks. And those who have not yet joined our Divine School of Homeopathy, the YouTube channel, just subscribe. You don't have to pay anything for to subscribe our channel, the Divine School of Homeopathy, so that you can get lot of things over there. And second important thing, yes, be a member of our school. You can contact Dr. Prerna, her number is there, and you can, yes, Nisha, what's your question? You can ask.
Hello, sir. My question is, why did you start with the 6C potency in condylometa cases?
Condylometa is the most external aspect. It is at the level of mucocutaneous junction. Whenever you come to the surface specifically, then you have to use very low potency first. Then remedies works very fast. If you give high, it never works. At the mucocutaneous junction, condylometa is always there at the mucocutaneous junction. So this is the reason that's why I used to use the 6 potency. Yes, sir. Shirsagar, sir, you have any question?
Sir, actually, I wanted to ask you, can we use Kent repertory even now in spite of the
Yes,
newer
yes,
additions like synthesis or
definitely,
complete repertory?
definitely. It is a big source and a very important, confident source.
Acha, okay.
Dr. Raji?
Sir, I have a question regarding biocombinations, sir. Is it safe to use combination
Very
number
safe.
126? I have not yet have
You
some awareness for
you go through my video channel. 72 videos are there on this biochemics. You can get the action over there.
Okay, sir.